So next assessment, another assessment, clinical assessment in the diagnostic process. So we have to check for the face. The facial appearance also very important in the assessment of the person. So that's also one of the major diagnostic feature. So here we have to find the different types of the faces. So what faces indicates the what complications or what is the conditions. So we can see so many different types of the facial appearance we can found out. So this is going to be hypothyroid face, is a thyrotoxic face, acromegaly face, Cushing face, thalamic face, Down's face, anemic face, and also sclerodermic face and a Struck-Weber face. So this is going to be different type of the facial appearances in the abnormal in the different like a disease process. So we are going to discuss one by one here. So with this one, if the person comes during the observation itself, we can predict something related to the conditions. So if any patient comes with symptoms or with the baby having a bluish discoloration, or the baby, the height, the face is different. So we can easily rule out the what is the problem they have. So for example, the Cushing syndrome. Cushing syndrome is nothing but is a endocrine disorder. So which is a increase the adrenal cortisol. So if because of the increased cortisol productions, so they may chance to get the Cushing syndrome. So it produced the so many complications. So the face is going to be like a moon face, is a rounded face with a red cheek. So here this complication, face is round and also cheeks are going to be red. Excessive hair growth may be present in the mustache and also side the burnt areas on the chin. So here we are going to found the is excessive like a mustache and also is going to side areas. So this is a person to person. Here we can found the like a moon shape, the redness and also like a puffy face. So this because of the hormonal imbalance, that is the increased adrenal cortisol. So this is the one type of feature. So and also nephrotic syndrome. Nephrotic syndrome is because of the kidney disease. So or maybe if the nephrons are failure, so there is no proper filtration of the waste materials, that is excretory system failure. So this is the face is going to be edematous and also often pale. You can see here the appearance is going to be the pale, and also swelling usually appears first around the eyes and in the morning. So if you see here in the eyes, and the eyes may become the slit like when edema is severe. So it's going to be appear completely like a puffy face. It's going to be like a full swelling of the face. So this also one of the causative factor for the kidney symptoms or kidney failure, nephrotic syndrome. So another type of the face is going to be the mixed edema. Mixed edema means who are having the hyposecretion of the thyroid gland. So that is hypothyroidism. Hypothyroidism also called as the mixed edema. The face is going to be dull and also puffy face. So here also is going to get the puffy face, but is going to be bright here. But this one is going to be the dull and also puffy face. The edema often is the pronounced around the eyes, does not pit with the pressure. So there is no pitting edema. If you press, no depression and also no shallow appearance. The hair and eyebrows are dry and coarse and thin. The skin is dry. So this mixed edema people, they will get the so many complications. So it's complete. They become a little bit chubby and also fat accumulations, and also their face is going to be round and fluffy. The remaining the skin is going to be dry. So that is the features of the mixed edema. So we can easily identify without taking the investigation procedures. At least we can before the diagnosis we can like a pre-diagnosis we can give the provisional diagnosis with a small observations with these features. So coming to the another type of the face is going to be Down syndrome. So if you see the Down syndrome, so this is like a genetic disorder. So this face usually small and rounded head and also flattened nasal bridge. So here is going to be the forehead and also this nose is going to be flat and also oblique palpebral features. So palpebral feature is going to be oblique and also relatively large tongue. So their tongue will be the large. So these associated features including the generalized hypotonia, their body tone, muscle tone will be is a very weak or maybe is the less body tone. For example, in the normal muscles, the muscle tension is there. But in this Down syndrome, they may chance to get the hypotonia. The tone will be less and also functional activities are going to be slow compared to the normal persons. And also they are going to get the transverse trauma is a crisis. So they're going to get the same lines. So they're going to, in the hallways, they're going to be like a dull, and as hands going to be like a creases, and also shortening and also incurving of the fifth fingers. So that is the fingers are going to be very small. You can observe the fingers. So this is going to be, they are going to get the clindodactyly. That means the fingers, the digits are going to be small compared to the normal person. So the growth will be less than the normal persons. So and also the brush field spots and also mental retardations. So they are may, because of the IQ is going to be less, and also the what the external like a skills are going to be slow compared to the normal child. So that are, those are the features of the Down syndrome. We can easily found the appearance of the face is going to be a little bit different to the normal persons. So the face is going to be small, and also the nasal bridge is going to be flattened. So these are the special features of the Down syndrome. It's a genetic disorder. And also coming to the other facial expressions, the fetal alcohol syndrome. Fetal alcohol syndrome means if the mother, when the mother carrying time, if the mother is addicted to alcohol, so the baby born woman with the chronic alcoholism are is increased risk of the growth deficiency and also microcephaly. Just now we saw the while explaining the head circumference microcephaly. So this microcephaly, one of the causative factor is fetal alcohol syndrome. If the mother is taking alcohol during the pregnancy, is an overdose of the alcohol, the baby also may affects to with the alcohol effect. And also because of this alcohol syndrome, the baby also will get the mental retardations. And also, if you see the facial characteristics, including the short palpebral fissures, wide flattened sophiltrum, so he's going to be, and also thin lips. So he's going to be here, and also he's going to be palpebral fissure is going to be is an oblique fissure. So these are the clinical, like easily identify the special features of the fetal alcohol syndrome features. And also next one is the congenital hypothyroidism. So just now we saw the hypothyroidism in the adult we called as the myxedema, and the child in the congenital from the babies we called as the cretinism. So this one is going to be has a coarse facial features, low set hairlines, and also space eyebrows are going to be, and also enlarged tongue. The tongue is going to be bigger size. Its associated features including the is a horse clay and also umbilical hernia. The baby may chance to get the hernia extra, like a bulging in the umbilical region, any displacement of the uh, like an internal organ of the body. The body is become dry and also cold extremities, mixed edema and malted skin, mental retardation. You can see here, we can see the face features automatically is a pale, and also the appearance will be very small than the normal people. The head size and forehead size is going to be altered. That is the most infant with the congenital hypothyroidism have the no physicals and stigma. This has held to screening of all newborns in the United States and most others develops in the countries for the congenital hypothyroidism. So there is no exact like a signs and features of the congenital hypothyroidism. The doctors and also they have to rule out the so all the signs and symptoms according to the patient conditions. So these are the some facial appearance, facial abnormalities because of the congenital abnormalities, and also because abnormal health, abnormal like a hormonal imbalance. So another type of like facial abnormalities is the parotid gland enlargement. So parotid glands. So you can see here like a mum's appearance. So this is going to be swollen. So these parotid glands are located in the below the jaw. So it's going to chronic bilateral. So asymptomatic parotid gland enlargement may associated with the obesity. So they may chance to get the hormonal imbalance with the obesity may chance to get, and also with the obesity, diabetes, cirrhosis, that's a liver damage and other conditions. So these type of complications are always associated with other complications such as diabetes and also cirrhosis, and also is the obesity. So note the swelling of the anterior to the ear lobes and above the angle of jaw. Here you can we can see the swelling we can found it here anterior to the ear lobules at the angle of jaw. So this is the classical feature of the parotid gland enlargement. So if the person having like a chubby face or also like a mum's appearance, mum's means swallowing of the these parotid glands, or maybe the gradual unilateral enlargement suggests the neoplasms. If only one side of the enlargement, it indicates any cancer or neoplasms. So in case of the acute enlargement seen in the mumps, mumps means is the infection of the parotid gland. So if any infections, it may swollen. That is an acute one. But is a gradual one. If it is unilateral, it may be neoplasms, or it may be because of the both sides, or it may be because of the parotid gland enlargement. So this also we can found the abnormal face appearance. And also another important feature is the acromegaly. So acromegaly is the especially is the excessive growth hormone secretion. Because of the excessive growth hormone secretions, the body height is going to be increased. All the like a musculoskeletal system is going to be structure and function is going to be altered. So if you see here, the face is going to be the larger size. All the jawbone and nose and all the facial bones are going to be the larger size. Not only facial, total body is going to be like a it's a bigger size because of the excessive growth hormone. So the increased growth hormone of the acromegaly produce the enlargement of the both bones and soft tissues. So the head is enclosed with a bony prominence of the forehead and nose, lower jaw, soft tissue of the nose, lips, ears also enlarged. So all they're going to get the enlarged soft, and also the facial features appears generally is a coarsen. So it's going to be looks like is a not like ugly appearance, like because of the growth. The tissues, the soft tissues as well as the bone tissues are going to be abnormal shape and size. So that is about the acromegaly because of the hormonal imbalance. If any person comes, easily we can identify. See here, you can see the features of the normal person with the acromegaly with the extra excessive growth of the hormone. So here you can see the frontal and also maxillary sinus. So enlargement. Here is going to be the frontals and also maxillary. See here, the maxillary bones are the bigger size here. And also here the growth of the mandible. So is going to the they are going to be the prognostum. So this mandible is going to be very long, is going to be enlargement. And also we can see that the shape and also ear, eyes also going to be altered. So here you can see here the appearance of the shape when he was in the 20 years, when he was in the age growth, the appearance will be total. The jaw appearance is going to be increased. The facial and also maxillary bones are going to be increasing size. So that is about the special characteristic features changes in the acromegaly, that is in the facial changes. So next, also one more thing is the Parkinson's disease. So another abnormal phase we can easily find in the Parkinson's disease. Parkinson's disease is nothing but a neurodegenerative condition. So if anybody having any abnormality in the basal ganglia, so they may chance to get all the symptoms such as they may chance to get the rigidity and also echinacea and bradykinesia, tremors. So this is the like a neurodegenerative. So if any damage the basal ganglion structures, so may chance to get and also the major features are the expressionless face. So whatever if they are happy, if they are sad, so they cannot express the emotion, that means the sad or a happy. So here is they're going to get the like a facial nil facial experience as facial expression. So here decrease the facial, the mobility, the blunt expressions. It's a mask-like face. So how if they put the mask, how they are going to put the expression. So they're unable to do the facial expression, right? If they any like a facial mask or in the beauty. So something like if they put the mask, how they are going to be stick. Whatever you say something, they are going to be abnormal. So no response. So that is called as the like a mask-like face. And also is which decrease the blinking and also decrease the blinking and characteristical stare. So there is no blinking and also always staring. Whatever you explain, they are going to stare on you. So this is because of the loss of expressions. So there is no proper movements. So these are the like a movement disorder. It may produce the movements. So the movement is will be less. That is bradykinesia, slow movement. While walking also, their movement will be very slow. And also if they want their posture also going to be changed here. Since the neck and upper trunk tend to flex forward, the patient seems to the peer upwards towards the observer. Facial skin become oily and drooling may occur. So it's if you see the major clinical features, so the face is going to be the oily and also the odor will be different. The foul smell may chance to get because of the oily secretions and because of this most commonly seen in the old age after the 70 years of age group. So these people may chance to get especially. So this is the special like a face appearance. We have to understand about the what is the special features. Then we can easily, if any person scheme with so we can without diagnosis, that means without investigation procedures, we can predict and also we can like a pre-diagnosis That means the prognosis, like provisional diagnosis we can give according to the symptoms. So another appearance is the microglacia. So this is generalized is a visceral enlargement. So they are going to get the visceral is going to be enlargement in condition of the microglacia, and also broadening and also enlargement of the hands and feet due to increasing the posterior wall growth, well, the thickness in the skin. So the skin also become thickness, and also they may chance to get the enlargement of the bones, especially the fingers and nails and skin. And also if you see here is going to be the tongue also become the bigger size. So these are the most commonly features found in the acromegaly, so because of the growth hormone. So another disease is a Graves disease. So this also going to be is most grave disease nothing but is a hyperthyroidism. So increase the secretion of the thyroid hormone. So it may use the like these expressions like a is a bulge. The eyeballs are going to be bulged and also protruded. So this type of facial expressions commonly seen in the hyperthyroidism. So here is going to be ocular involvement is mediated by one or more districts, but the still poorly characterized by the orbital stimulating immunoglobulins. So they are going to get the prostatosis due to increased volume of edema of retrobulbar fats. So the eyeballs are going to be protruded and also bulging. Shortening of the extraocular muscles. The ocular muscles, eyeball muscles are going to be short. So because of the contraction of the eyeballs, so the eyeballs are going to protrude forward. The eyeballs mainly the ocular muscles are the is rectus muscles, the superior rectus muscle, inferior rectus muscles, and medial rectus and lateral rectus, and also oblique rectus. So these rectus muscles are mainly is helpful to the ocular muscles are going to be helpful to the eye movements. So if you want to move upwards and downwards, side to side, so it's controlled by ocular muscles. So if any damage or if any abnormality in the muscles, and also because of the any edema around the retrobulbar fat, because of the fat also, these eyeballs are going to be protrude. This is the classical feature of the hyperthyroidism. So, and also here is going to be conjunctival erythema, periorbital edema evidence. So, there may chance to get the edema around the face and also around the like orbit, surrounding to the eye. These are the classical features of the hyperthyroidism. So, if any person comes with like this type of symptom, easily we can add, okay, this person having the like extra like a secretion of the thyroid hormones. So, they because of this abnormality, they are getting this type of symptoms. So we can easily rule out the disease progress. And also next one is the another type of the hypothyroidism. So hypothyroidism also they are going to give the almost in the one their expression is going to be face is going to be like a face hypothyroid faces is going to be slow and also harsh voice develops. So they are going to get the harsh voice and also they are going to be like a dull appearance, the puffy faces. Edema does not with a puff pit. That means there is no pitting edema. They will get the edema, but there is no puffy face. So just now like a mixed edema. So this also type is a mixed edema. So the lateral eyebrows are very thin. So if you see here, the eyebrows are going to be thin. So with these features, we can identify are they having any abnormal function. That means imbalance, hormonal imbalance or not. So these are the classical features of the facial appearance. So according to the facial appearance, we are going to detect we are going to diagnose the easily with the disorders.